the roads.
Right now at 5:30, Women's Health Headlines, where we focus on health stories specifically impacting women. It is Breast Cancer Awareness Month, and we are finding out what effects COVID-19 vaccines may have on mammograms and ultrasounds. Joining us now to break it all down is Dr. Diana James, the head of imaging with Jefferson Radiology. Dr. James, good to see you.
Good to see you too, Erin. Thanks for having me.
Of course. So there has been a lot of talk, even when the shots originally came out, about the connection between the vaccine and getting a mammogram and ultrasound, and whether you should delay getting one a couple of weeks after getting the vaccine. Let's get to the bottom of it and exactly what people need to know.
Absolutely. So we know a lot more now than we did before, for sure, in the beginning of the year. So we were telling patients to delay. If you were getting your vaccine, we said put off that mammogram for 4 weeks. Really, only about 10% of patients that are getting Pfizer or Moderna have this reaction. And the reaction is essentially just a little bit of swelling under the arm, these abnormal lymph nodes. We know now that even if you get those, you're in that 10% of the population that has that reaction, we can just track you with ultrasound. It's no big deal. We have protocols in place. We've now gone almost 9 months kind of watching this unfold. So there's really no reason to kind of worry about, I'm worried about my boosters right before the mammogram. Should I still schedule? Yes, still keep the appointment, stay on track. We know now that a lot of people put off those health appointments, during the pandemic and even after the pandemic. And it's fine just to get back on track and don't worry about it.
So just to be clear, even with the vaccine booster on the horizon, which potentially may be a little bit different, is women should still book their mammogram. Do not worry about if it's 2 weeks before or say 2 weeks after getting that booster.
If you have a range of appointments and a lot of flexibility, then ideally, sure, book the mammogram or ultrasound before the booster. But if, you're in a tight spot and you're working and you're trying to fit all these doctor's appointments in and keep your health going, I wouldn't worry about it. Honestly, like 90% of the time, you're going to be fine. And even if you're not, we know what to do now. It's just a couple extra ultrasounds. It's really no big deal.
You also brought up a great point that many women missed their mammograms in 2020 and maybe even in 2021 because of this pandemic. What is the biggest thing you have to say to those who have not gotten their mammogram recently?
Still, please come in, whatever it takes, whether it's grabbing that friend or it's, we have evening appointments, weekend appointments. I know a lot of places do. Bring your mother, whatever, you need to do to make it happen. As we were talking about last week, it's a 15-minute appointment. You're in and out in less than 20 minutes. So it's not really a time issue. It's a little bit uncomfortable, during the actual exam, but I would really encourage people to really, if they haven't seen their doctor at all in 2020 or 2021, go for those regular primary care visits and definitely book the mammogram for sure.
And it can't be worse than giving birth. So there's always that. Dr. James with Jefferson
There's always
Radiology.
that. Got it.
Thank you so much as always. We appreciate it.
All right. Thanks, Erin. Appreciate it too.
Take care.